Welcome to the office of Dr. Richard Levin and babiesbylevin.com. Dr. Richard Levin is America's first tubal microsurgeon and has been featured on Good Morning America, The Phil Donahue Show, People Magazine, ABC, CBS, and NBC nightly news programs, as well as other media from around the world. Patients travel from all over the United States and from every corner of the globe to seek his expertise. Dr. Levin offers one of the highest success rates for tubal ligation reversals at an affordable price. Join us to find out why so many women refer Dr. Levin to family and friends, and how he can help you achieve your dream of having a baby.
The morning after surgery, I will be coming to your room generally between 8 and 9 o'clock local time. It's 7 o'clock prior to me coming there. I want you to take your shower, dry off, and then go to bed. And then I want your travel companion at this point to peel the dressing off. Now, you start by peeling the edges of the white foam tape. It's a white stretch foam tape. You peel them all the way around, and then you gently peel it off like you would peel a banana. Usually this will all come off in one fell swoop, so the foam tape will come, the underlying pad will come. Sometimes the saran wrap layer will come with it, along with the two white Telfa pads that are under there. If, however, they do not come separately, once the tape and the pad comes off, there will be one white Telfa pad sticking out from the shiny saran wrap. Take that and peel it in the opposite direction down towards your feet, and peel it once again, just like a banana, slowly and surely, until the saran wrap layer is off and both white pieces of Telfa are off. Underneath that, you will see the Steri strips. Leave those alone, leave them in place. Now, the final thing that you should do that morning before I come is to take a panty liner, put it on the inside of your panties facing the incision, and that way, if anything oozes from the incision, it will get on the panty liner and not on your clothing. Once you go home, I want you to put saran wrap around your incision before you get into the shower. So have your companion twirl it around you 2 or 3 times around your waist, covering the incision, and then I want you to pat it down so that it's nice and sealed. If a little water gets on it, it's not going to be really harmful, but the drier you can keep it, the better the Steri strips will stay applied. When you finish with the shower, then take the saran wrap off, pat the incision dry, and let it air dry before you put any clothing on. Dry to the touch is best. As long as the Steri strips are on, and even after they come off, I do not want you to put anything on the incision. I don't want any alcohol, peroxide, neosporin, or any scar guard products put on it. If you think that there's a problem with the incision, send me an email, send me a digital picture in focus, please, and if something needs to be done, I'll tell you what to put on it. 1 week after the procedure has been done, you need to get into a warm bathtub, get the water up over your Steri strips, and let it soak for a while. Once it's nice and soggy, you can either within the bathtub or once you get out, you can peel the Steri strips in a similar fashion to what we're showing you on screen now. You should peel the Steri strip from the top down to the incision and then stop. Then take the same Steri strip and peel it from the bottom upwards toward the incision. Once you've gotten to the incision, you can gently lift the Steri strip off completely. Once the Steri strips are off, you can shower normally without covering the incision, or you can get in the bathtub. I do not want you to get into the bathtub if there's a little gap in the incision, however. I don't want infected water to get in. You should not be afraid of these little gaps, as they will close from this point to the 6-week point. If, however, you're concerned about it, you can send me a digital picture and I'll look at it and let you know if anything else needs to be done. During the 6 weeks, I do not want you to put anything on the incision once again unless instructed to do so. So do not use any alcohol, peroxide, neosporin, or scar guard on this unless you're instructed by me to do so. Once you hit the 6-week mark, the incision is appreciably completely healed and as strong as it's ever going to be. You can resume complete normal activity at this point with heavy lifting, bending, and stooping.